there is a much better understanding of COVID-19 and how it spreads now than when it first hit the world, but there are still many unknowns. One person working on this is Simon Cornell from the University of Johannesburg's engineering faculty. He's been developing and using smart technology to estimate the probability of infection, and he joins us now. A very good morning to you, Simon. I mean, this is quite groundbreaking because in some instances, as you've mentioned in the articles you've written, the 2-meter rule isn't always possible to be followed. So how is this technology going to work?
Oh, good morning to you and the listeners. So what we're hoping to do, and in fact what we're busy doing, is develop 4IR technology, high-performance computing, model the situation, create effectively a digital twin of the entire situation. And that model is interdisciplinary. It has engineering principles as well as medical principles, which is to say that it can model the airflow, it can model the droplets, it can model the physical evolution of the droplets, taking into account humidity, temperature, evaporation, chemical properties, as well as salinity, pH. And then as the droplets evolve in the airstream, the medical knowledge comes in here, and we look at the attenuation of the virulence of the virus. So we look at effectively labeling each droplet with infectiousness. So you can track in real time, as time moves on, the infectiousness of the droplet. Does the droplet plate out on a surface? If so, how does its infectiousness evolve there as well? So it's about merging engineering principles where you can model airstreams and then medical principles.
Yeah.
And basically it doesn't stop there, because you use lasers to give you a 3D geometrical map, complete also with the material of the surfaces. And then there are anemometers that give you the airflow in that same environment, and then thermal cameras give you the temperature. So there's a 3D model that's very accurate of the entire space that you're looking at. And these would be claustrophobic spaces, could be taxis, public transport, where people congregate where they have to, for example, in schools and universities. Then it could be where the frontline workers, public health people are, and that is clinics and hospitals. And it would take into account as well so-called engineered medical interventions. Now, these are interventions that will future-proof us against all future viruses of this respiratory virus nature, where the infectiousness and transmission is airborne. So what are then the engineered medical interventions that you can insert into those environments? And for example, one of them that can now be optimized is the so-called germicidal ultraviolet. These are air tunnels that process all the air in the room within a certain time regularly, and expose the airstream to germicidal ultraviolet light, thereby rendering it safe. And then you could look at issues like, are there dead spaces? Are there spaces where the virus collects? Are there spaces where engineered medical interventions cannot be effective? And so on. You can optimize the placement of these interventions. You can choose which ones you should be using. You can, in fact, conduct research now where you have this digital twin where you can assess their performance. And so the idea is, how would we not only deal with this COVID-19 virus, but what about tuberculosis, which is already a problem, and what about future pandemics?
Yeah. Simon, so obviously the hope here is that the industry will embrace this new model at some point, correct?
That's right, yes. So we would be able to regularly provide information which we will release really as research papers, and we will be able to assess environments and also engineered medical interventions.
All right, thank you very much, Simon, and keep up the good work. That was Simon Cornell from the University of Johannesburg's engineering faculty.